Maintenance therapy is huge in AML right now. So I think for years people have been trying to use maintenance therapy in AML, trying to develop new strategies similar to how we do in acute lymphoblastic leukemia. Unfortunately, trial after trial proved to improve relapse-free survival or progression-free survival, but had no impact on overall survival until recently. The randomized trial of CC486 compared to placebo in patients who achieve remission but are unable to complete their consolidation showed a significant survival benefit of CC486 compared to placebo, sort of solidifying that drug as a standard of care maintenance approach in AML. Now that really opened the doors and the excitement again in the AML community to try maintenance approaches once again. And so we're now building on our initial excitement with CC486 with new approaches. So in patients who are FLT3 mutated, for example, can we use post-remission FLT3 inhibitors in combination with CC486 or other oral hypomethylating agents such as decitabine? We're doing a trial based on that. Similarly, in subgroups like IDH1, IDH2, can we combine ivosidenib or enasidenib with hypomethylating agents as maintenance therapy in patients who are ineligible for transplant? And finally, can we combine venetoclax, a drug that's shown significant activity, with low-dose hypomethylating agents, either oral azacitidine or oral decitabine in the maintenance setting in these patient populations to further improve overall survival in these patients and hopefully continue to reach higher rates of cure. The final thing I would say about maintenance, I think, is another exciting area, is post-transplant maintenance. I think similar to what we do in Philadelphia positive ALL, I think we have opportunities in FLT3 mutated AML, in IDH1 and 2 mutated AML to use these small molecule inhibitors to promote improved relapse-free survival and overall survival in that patient population. So there's a lot of data upcoming in that setting. We know that sorafenib is active, but I'd like to see some data from gilteritinib as well as the IDH inhibitors.